Hello and welcome to Supporting Our Children During the Global Pandemic, focusing on the mental health needs of our youth. My name is Jamie Stormer and I'm the Director of Children's Outpatient Services in Alachua County for Meridian Behavioral Health Care. Today we are going to talk about addressing the return to school, but before we do that, I would like to review a little bit about what we talked about in our last session. So first and foremost, remember to be talking to your children about this pandemic, even as it persists. Make sure you're keeping your conversations developmentally appropriate, sticking to facts, and addressing rumors as your children bring them up. And making sure that you're reassuring your children that you are there and your family is there to make sure that everybody is safe and healthy. It's okay to say that you don't know an answer to one of your child's questions. And remember to remind them that we are still learning about this virus and that new information comes out every day. Another point to remember is we need to keep our children engaged in activities, especially when we're spending more and more time at home. For young children, you want to have some options for activities, toy rotations if possible, so they have a choice of what they can do and you're able to switch out activities to avoid them getting bored. It's important to engage in some physical play and outside play along with other activities inside the home. Video chats and social interactions are still important during this time, so when you're going to do these activities, especially with young children, make sure you're planning for a good time of day, and children are not tired or hungry, and that you're able to engage them in conversations with the people that they're chatting with. So asking your participants maybe to read a book to them or to have topics of conversation that they would like to talk about with your child would be helpful in keeping them engaged. Also, throughout the day while you're at home, it's important to incorporate some academic skills, and you can do this by doing chores or cooking. Those activities lend themselves really well to math type activities. So you can ask your child to count something, to measure out the amount of ingredient, to predict how long something will take to cook, and then or compare sizes of fruits and vegetables. You can also incorporate some math activities in gardening, so getting them outdoors and doing some gardening. You can help them predict how many days that it will take to see some growth, or counting seeds or tallying days to keep track of the progression of what they're working with. You can also implement some reading activities like creating a daily book reading time, identifying some vocabulary words and asking your child to use them throughout the day. And then also for writing, you can create a writing center within your home with anything that they might need, including a desk or writing utensils, coloring utensils, things that they can use to write letters or journal, or create other stories or art projects. Additionally, you want to encourage safety. So especially as things are opening up and people are going out more and more often, make sure you're implementing clear rules that will keep you and your family safe. So talk to your children about what those rules might be, letting them know that the more safety precautions they're taking, the more comfortable you are going to be with letting them have a little bit more freedom. And work together on identifying what is important to you as a family and how they can take steps to stay safe. So you might need to help them with practicing staying at 6 feet of distance apart. You can talk about outdoor activities that they can do with others that allow them to maintain that social distance. And then talking about masks and practicing wearing masks or facial coverings. You can also remind them, this is not going to last forever, and helping them put that into perspective that this is a temporary time and that they'll be able to get through this as they have done many other times before. Again, with safety, we want to make sure we have all of the information that we can possibly have, so make sure you're using trusted sources and getting fact-based information and turning to those trusted sources like the CDC, the World Health Organization, NPR, or even calling your doctor or your child's doctor to ask for some additional information. And finally, Make sure you encourage your children to engage in coping strategies, and this is good as a whole family as well. So as parents and children, it's always important that we're engaging in some social coping activities. So discuss strategies that you might have found helpful in your own life, whether that be breathing and mindfulness type strategies, something like reading a book, taking a break, doing a walk, anything that helps you relax and take some time for yourself, and engaging in positive activities. And these may be different for every person in your family, but making sure that you're identifying some of those positive activities that your child is willing to engage in and take a break from all the stress of the day. So as children are returning to school, it's going to be even more important to support their mental health. It's important to initiate conversations about the worries that they are going to be having as they get closer to that first day. It's important to encourage them to share what they're feeling with you, and you should be able to validate their worries. And letting them know that it's okay to feel nervous about what is going to happen on that first day of school. You can talk to them and asking them open-ended questions like, what are they most worried about? And being engaged in the conversation about what can they expect, what changes might they see as they go back to school, or if they're doing virtual schooling, what might be different about how they're learning this year. And try to identify some of the positives about what's going to come, whatever mode of learning that they're going to be engaging in, what good things are going to come out of it. Provide reassurance for your child as well that the family is choosing the school option that they're choosing to make sure that everybody's safe, and encourage them to come to you with any concerns that they have. Especially if they're going back to school, if they're noticing others are not taking precautions, or they're having difficulty wearing their mask or facial covering every day, talk to them about what safety measures that they can put in place, and how they can ensure that they're feeling safe and supported. Make sure, regardless of the mode of learning, you are following a regular routine. Children need this, especially around school and schoolwork activities. So encouraging them to stick to a routine, again, same bedtime, same meal times, and just getting them into a routine so they can predict and know what to expect each day. And finally, check in with your child regularly about their emotions, how they're doing, especially those first few days of school. Encourage them to talk to you about them, and be mindful of your own worries and your own feelings as it relates to your child going back to school, because it's normal to feel all of those concerns. Children they pick up on our emotional cues, so take a second to calm yourself down if you're feeling extra anxious about what they're going through. And remember to watch for some of the warning signs that something more may be going wrong or going on with your child. Things like, for young children, crying, having difficulty staying still, other behavioral changes, sleep problems, and for older kids and teens, acting out or having unhealthy eating habits or other behavioral issues. Again, watching for those warning signs and understanding that younger children may experience different signs than older children, and every child is going to be different. Any significant and abrupt change in behavior or mood may be cause for concern, so please reach out and get some assistance when needed. You know your child better than anyone most of the time, so have confidence in your instincts, and it never hurts to reach out for help. As your children are returning to school, undoubtedly these challenging times are really highlighting the differences within our community when it comes to any precautions that people are taking, or beliefs about the virus and whether or not we should be returning to school. So check in with your child about how they're feeling, about the differences they're seeing within their friend groups or with their teachers, and how they're approaching virtual learning versus in-person learning. So discuss with your children if they're concerned that their friends won't be with them, either in person or in the virtual learning classroom. You can come up with ideas of ways they can still interact with their peers, even if they're not face-to-face with them, and discuss with them some issues that might come up related to differing opinions on taking precautions. It's really important during these times to model respect and acceptance of others' opinions. Review your family's plans and discuss why you have decided to take the precautions that you are taking as a family. And acknowledge that other families may have differences of opinions, and that's okay. But for now, these are the decisions that you have chosen, and try to help them problem solve ways that they can still interact with their friends, but maintain that safety for them. And again, it's especially important to model that respect of others' choices so that your children will also do the same. As we get ready to go back into schools, it's important to make sure they're communicating with teachers and administration individually so that you know what to expect. Ask them questions about what the school year will look like, what the classroom will look like, how will students that need extra support be referred for those services, if there's any bullying or stigma against those who have been sick or have the family members that have been sick. How will the school be addressing those concerns? Are there going to be any changes to bullying policies, and how will those look? And how can you support the school safety efforts as a parent and family member of children in the school? And it's especially going to be important to inform the teachers and the administration of any specific challenges that your child has experienced over the past few months, whether that be the loss of a family member because of the COVID-19 virus, or significant anxiety that they've experienced related to the virus or related to going back to school. So that way there can be a plan in place when your child returns. And if your child has had an individualized education plan or a 504 plan with accommodations, it's important to ask your teacher and the administration how those plans will be implemented, whether in person or virtually this year, so that way they get all the supports that they need academically as well as emotionally. As I mentioned before, there's definitely some differences of opinion regarding COVID-19, and with that comes a lot of stigma and potential bullying opportunities for individuals that have had the virus or are taking certain precautions that other people don't agree with, or are not taking precautions that people believe should be in place. So as they're adjusting to a return to school, children may encounter some of these issues. So it's important to be ready to combat any bullying or stigma within the family. So as a caregiver, it's going to be really important that you model acceptance and compassion for all groups of people, and talking to children instead of focusing on the people in the area that this virus has originated. Talking to children about the origin being a geographic location and taking that focus away from the people in that area. So that they're not associating this group of people with starting this virus, because as we know, that was not the case, and nobody should be blamed for having a role in spreading this virus. So again, modeling acceptance and compassion, avoiding negative statements and stereotypes about other groups, and showing them how you're reaching out to others who might be at risk. It's important to provide information and sticking to the facts about how the virus is spreading, and focusing on the safety aspect and what can we do to avoid spreading it ourselves. If you hear of bullying or you hear your children making negative comments, make sure you stop those immediately and help them understand that in your family, this is not an acceptable way of treating other people. You can talk to them about why we don't want to be spreading these rumors and stereotypes, and how it's important to be respectful with others. discuss if they're having difficulties understanding their feelings and hearing all of these things about groups of people, talk about ways to express their emotions, discuss how it would feel for them to be blamed for something that they were not responsible for, and relate it to a time where maybe they have experienced something like that. Provide them with those skills to take perspectives of others. And you can use activities like role playing and engaging in discussions with them to talk about what's scaring them the most and getting at more of the root of their fears regarding the virus. It's important to emphasize positive images of diverse groups, so helping them identify individuals within your community or celebrities or important historical figures from different groups that have had a positive impact on society and in our country, to help combat some of those negative stereotypes that have been going around. And encouraging them to help others in need with people from diverse backgrounds. So getting involved in community activities that are safe to do so, and spreading positive messages about different groups. And along with that, learning about different diverse communities and faiths to help them understand others and their beliefs. And that can include reading books that address prejudice, tolerance, and hate. So really, it's just about showing respect for others and really supporting our children on addressing their needs without stigmatizing one group or another. For your own child, it's important to watch for some signs that they may be experiencing some bullying for whatever reason, whether it be illness related or because of the precautions that you and your family are taking. So make sure that you're watching out for signs of isolation or refusing to go to school. If you're noticing that your child is withdrawing from friends or activities that they used to enjoy, or they're coming to you and reporting bullying, harassment, or intimidation. Stress and trauma from bullying can have a lasting impact on functioning, so we want to make sure that we get children help as soon as possible. So remembering that if a child's having difficulty, it can manifest as internally, such as like anxiety, some depression, or fear. Sometimes it can show itself as anger, or they might be having some external reactions, such as being more reactive to comments made. They might be having more aggression or defiance. So watch out for those significant behavior changes or changes in attitude, as they might indicate signs that they're experiencing some bullying at school or in the virtual school. So as we've mentioned before, safety is definitely of importance. So make sure that you are talking to your child about safety. You want to provide opportunities to talk. You want to set limits around media. Sometimes we're getting too much of the information. So taking a break from media coverage of coronavirus and returning to school and all of the controversy that goes along with that. Providing that structure and routine throughout the day, reminding children that adults are there to take steps to help keep them safe, and allow them to talk about their feelings as they come up. Make sure that you're encouraging those healthy and safe coping strategies. Find what works for your child, and engage in some of those coping strategies together. Make sure that you maintain contact with your teachers, share information, get information from them about what's going on within the classroom, if they've noticed any bullying activities or any unsafe behaviors, and share your concerns with them as well. You want to focus on your child's strengths, and promote their sense of belonging. So discussing their unique skills and what they can bring to relationships and interactions with others. And it's important to seek help immediately if you notice a problem. Help children find others that they can go to, that they can feel safe with, and who they can share their knowledge and beliefs with in a positive way. So So specifically for children who are going back to school in the brick and mortar setting, it's important before that first day that you start talking to them about what the plans for reopening are going to look like. So thinking about what your children need to know and really laying that out for them and helping them understand what is to be expected. So if they're taking the bus, review the reopening plans for each of the schools that your child is going to and find out what changes might be on the bus. What are they going to be expected to wear? Where are they going to be expected to sit? When they get to the school building, is there going to be screening procedures? Will their temperature be taken? Are they going to be asked questions about their exposure and practicing what that might look like? And then as they get to the classroom, what distancing procedures are going to be in place? What will the classrooms look like? It may look quite different from what they remember from the previous years, so it's important to help them understand these things are going to be changing, but linking that to safety and the reason for these changes. And again, discuss their feelings on going back to school. Are they excited to go back to school? Are they nervous? Why are they nervous? Why are they excited? Don't just focus on the negatives and that anxiety, focus on things that they can look forward to as well, and aspects that they've missed about being in school and why they're happy to go back. And then finally, problem solve challenges that are inevitably going to arise as we enter school in a way that we have not in the past. So talking about what can be done if children find that their classmates aren't always following the rules. If there is teasing and bullying, who can your child talk to? Can they talk to their teacher? Can they go to an administrator? If there are signs that children are sick at school, who can they talk to? What can they do to make sure that everybody's safe? And identifying some of those things ahead of time will help them feel more prepared and less anxious should something like that come about. And it also, having that plan helps empower them that they can get through this and that they can make a difference in the reopening of school. Although we've been wearing masks for a few months now, some kids, especially the younger ones that may not have been going out into the community as much, might have developed a fear of masks. Before now, their exposure to masks may have been Halloween costumes that seem kind of scary, or going into a hospital with somebody who's ill. And that can be very scary for them. So it's important to talk to your children about the masks that they're going to be wearing, why we're wearing those masks, reminding them that it's a precaution to keep everybody safe and healthy, and addressing some of the challenges that do come along with wearing masks, such as kids not being able to hear others as well as they're talking, or missing out on those facial cues that sometimes we rely on to understand how others are feeling at the moment. So take some time to talk about those types of things and validate that this is definitely challenging, and we're all working together to find ways to make this a little bit easier for everybody. So you can also compare wearing masks to other precautions that we take every day, like washing our hands. So again, we wash our hands to make sure that everybody's healthy, especially after certain activities. So this is the same reason why we're wearing masks, is to make sure that we're staying healthy when we're around other people. To make it a little bit more fun for kids, you can let them pick out their masks. Many websites and stores are selling lots of designs for different masks. So allow them to take some ownership in this process and allow them to pick out the masks that they want, that represent who they are and what they enjoy. Along with just having masks, it's important to practice wearing the masks and reviewing with children how to put on a mask and how to take off a mask. Reminding them that it doesn't just cover your mouth, it covers your nose and your entire face, so that way we're stopping the spread of germs or reducing it as much as possible. and practice trying to read those facial expressions of the family members to see if they can guess what other people are feeling to make it a little bit more comfortable for them. And try a few days before school starts, wearing it for longer and longer periods of time, so that way they can get used to wearing it for an extended period of time. And finally, ensure when you're talking to your children that you are clear in what you are saying, trying to explain yourself as clearly as possible. If you're making a request or giving a direction, make sure your child understands it before sending them off to do it, so that way you can provide clarification if needed, and that just gives them that extra practice of interacting with this mask on. When we're talking about virtual learning, we saw this was a bit of a challenge when schools closed down back in March. So keeping in mind that children may need extra support and encouragement while navigating this new process. So it's important to have a space for children to learn at home that's free of distractions. There's lots of distractions when we're at home. So making sure that they're away from the TV, there's good lighting, it's a quiet room, that they can really focus. Make sure that there's a routine, giving breaks or encouraging breaks as the school schedule allows. This will be a little bit different from what was originally put in place back when schools started closing down. So talking to the teacher about what their schedule will look like, where will there be opportunities for breaks, and giving choices when it's appropriate. So if there is a break time, letting your child choose what activities he or she engages in, or if there's options for choosing the order that schoolwork gets done, allowing them to do that as well. So help them with some of that planning, and understanding that every child learns a little bit differently. So encourage the use of different strategies like visual strategies, auditory strategies, and using different modes of learning when possible. And allowing them to practice with information is going to be important. So they may need some extra time to review what they learned during the day, some extra practice with math problems or vocabulary words. So spending time to review some of those things as a family and help show your support. And then whether it is after school or during those breaks, make sure you're creating some opportunities for your children to play that allows them to explore and practice some of their self-regulation strategies. So it's important for them to have some of this time throughout the day to allow them to decompress, because it can be quite a challenge to adapt to this new way of learning. It can be important to do things like playing board games with your child to encourage any planning and problem solving that they can practice, or using music time to encourage creativity. Anything that will allow them to have a break from the academic piece, which is as important. On this slide, you'll see some resources to support that virtual learning. The first website is from the Child Mind Institute, and this provides a list of resources that is broken down by grade level from preschool to high school, and offers some different strategies to encourage and support that remote learning for each of your children. And then you'll see some information here specifically for children with ADHD or those that have some difficulties with maintaining expected behavior in the classroom or virtual classroom. Some activities to get them up and moving and get some of that energy out while they're doing their home learning. A lot of parents may be concerned that if their child is doing that virtual learning, they're missing out on practicing appropriate social skills while they're at home. So there's definitely some ways that you as a family can help mimic some of those social interactions and teach some of those skills at home. So first and foremost, in day-to-day activities, you can model social skills yourself. So engaging in activities where they have to take turns, you and your child are taking turns, or siblings are taking turns. So things like doing chores, maybe one day one child is setting the table and the next day another one is, or in certain video games, if they want to play video games, they're taking turns with each other, or if there's access to certain toys, encouraging them to take turns with those as well. Children need to learn to take perspectives. So talk about how you yourself are making decisions and what is leading you to behave in the way you do. And then looking at other people and then how are they behaving and why might they be behaving that way. So allowing them to take your perspective and other people's perspective and kind of relating it to their own behavior is important. And then looking at flexibility. So talking to your children about the choices that they're making and the actions that they're engaging in, and how can they do those different? How can they think about things differently, so that maybe there's a different outcome the next time. And this can be a positive experience or a negative experience that they've gone through, just looking at problem solving, some alternative solutions. You can also use fun activities like movies and TV shows to teach some of these skills. So, lots of shows out there, TV shows out there show kids in social interactions. So, using those to discuss social rules that maybe the social rule is broken. Maybe there was a challenging social interaction. You can talk about, you can make sure you use the pause and rewind features of the videos in movies or TV shows that you're using, to kind of stop and say, ask your children what went wrong in this social interaction, what could this person do different, and talk about the characters and the setting that they're interacting in. How might they behave differently if they were at home versus at school, or they were talking to an adult versus another child. So allowing them to identify those types of things. And we've talked about this before. It's really important to encourage connections, social connections. So allowing your child some time to do video conferencing, chats, and interactions with other people, and that can be online games as well. There is definitely a social component of that, so allowing them to get on those games with other children, especially if problem solving and cooperation is involved, it can definitely go a long way in helping those develop those social interactions. When we look at extracurricular activities, we know that this is going to be a challenge for this school year. As social distancing is still in effect, and there are lots of concerns about what will happen when school returns and what these activities will look like. The biggest challenge with these things is that sometimes for some kids, school is so challenging that the extracurricular activities are actually a big motivator to get them to do their schoolwork and to attend school every day. So you want to balance what your child needs in terms of extracurricular activities with what you as a family feel comfortable with, in terms of potential exposures or relaxing some of your social distancing rules. So it's important to reach out to the school and talk about what is going to be offered and in what format you can expect those activities to be offered in. And if they are going to be offered in person, asking what plans are going to be in place to maintain distancing or other social procedures, talking to the school and finding out, are there alternatives to being in person. If you're doing virtual school, will the child be allowed to participate via an online format? And when it comes to athletics, make sure you have that conversation with your child's coach. And again, weigh the pros and cons with your family. Talk to your child about why these activities are important, and try to find a balance of what you're comfortable with and what they need as well. School is not only going to be a challenge for our K through 12th graders, but also, any college students. So for parents of students that are returning or going to college for the first time, there are things that you can do to help your student transition back to this setting in a positive way. So first and foremost, encourage them to practice self-care. Encourage good eating, sleeping, exercise habits, and you can suggest some other positive activities and relaxation strategies that they can use. Help them maintain some focus. If they're living at home with you, or even if they have their own apartment or dorm, talk to them about how they can plan their space to help them maintain focus. Avoid judging some of the struggles that they might be having when it comes to completing their schoolwork. Just help them the best way you can, and just remind them to do the best that they can, and showing your support for what they're going through. Encourage them also to seek out support if needed. If they're feeling withdrawn or really anxious about what they're going through, make sure that they are seeking support from others, whether that be a professional or other students that are going through some of the same things. Talking about managing disappointment, for college students, there's also been a lot of disappointments that they've had to go through since this whole thing began, just like we saw with younger kids as well. Graduations were canceled, or end of the semester activities, or placements for internship opportunities all changed, and some of them lost their ability to move forward with some of their training. So talk to them about how they dealt with these things, and help them kind of plan for the future semesters. As with younger kids, it's also important for college students to limit media exposure, especially if they're having some difficulty with anxiety related to the coronavirus. So setting some limits for themselves on how much time they're going to spend watching the news or looking at sources of information, and instead spending some time in some other positive activities, and focusing on what they can control. So reminding them that we can't control other people's behaviors, but we can control our own behaviors. So what can they do to change their responses to what is going on, and change the way they're thinking of things, and hopefully change their mood as well. So whether it be a college student or a K through 12 student, that first day of school is going to be different and challenging in different ways for every child. So make sure at the end of the day, when they get home, ask about their day, talk about things that went well. What did they enjoy about it? Did they have a favorite subject, or how was their teacher? What was their teacher like? And really check in with them about how they're feeling. If there were any challenges that arose, and you talk to them about those things. What did they see? What could be better for the next day? What types of behaviors can be changed so that way they feel more safe or comfortable? And if needed, bring some things back to the teacher for the next day about some things that your child told you about, to help that conversation, and continue planning for safety while at school. And finally, it might be helpful for your child to plan a fun and relaxing activity that evening, to help them kind of decompress and relax after what will probably be a very special and stressful day. So spending time as a family and engaging in some positive activities that your child can see how much you support them. And finally, remember, we're worried about our children's mental health. We're worried about their social emotional functioning and their ability to move on after all this. So remember that most children are going to be okay. They're going to show their resilience and come out of this on the other side, just fine. So think about this and foster that resilience in your child. Give them time to adjust to the new school year. Try to avoid having expectations, of how they should be responding, and just focus on behaviors that you're seeing, the positives and the negatives, and just kind of monitor your child. It might take some time before your child is back to their typical self. So just give them some time to adjust. Be that supportive parent. Be that presence for them that's going to empathize with what they're going through, and allow them to talk as they need to, and identify what's important for them to be doing at this time. So identifying, is it being able to complete one activity independently, or is it that they learn how to be respectful and cooperative with other people? Is it doing chores? Like what is important for them right now versus those big picture things. So focusing on those little day-to-day things that can bring them some success, and find opportunities to practice skills and providing rewards for what they are able to do now. And be flexible with your children. Don't focus on perfection right now. Don't think about how perfect your child's grade should be. Focus on the process of learning and finding ways to improve that as they go. If you are concerned about your child, that maybe they're not developing in the way that you think that they should be, and it's to a level that's concerning, seek out professional help. If your child is constantly on the lookout for danger, or has a preoccupation with coronavirus, or thoughts of another traumatic event, or having persistent behavior difficulties, or showing extreme emotions, please seek help from a professional, and show your child that these reactions are typical. We're all having different reactions, but there are things that we can do to support each other. So remember, when you're coping with COVID-19, as parents as well, take breaks from the news, make some time to unwind, and setting your own goals and priorities. Take care of your body, make sure you're eating, you're sleeping, you're exercising, and engaging in those wellness activities. You as parents should connect with others as well and focus on the facts. Remember, the most important thing you can do when caring for your children is caring for yourself as well. And if you need some assistance with mental health, with your mental health or your child's mental health, Meridian is open. We provide in-person sessions, telehealth, or crisis response. So please call our access center. If there's an emergency, please call a Meridian Mobile Response Team, or if you're in Alachua County, the Mobile Response Team through the Alachua County Crisis Center. If you're in need of resources in Alachua County, our library partnerships, SWAG Family Resource Center, Cone Park Library Resource Center, are open for you. There's also the United Way of North Central Florida, our Early Learning Coalition, the Alachua County Public Schools, and the National Alliance on Mental Illness in Gainesville. If you're in the Tri-County area, please reach out to the Tri-County Community Resource Center, the Early Learning Coalition, the Levy County Library, and the Trenton Library for resources. And in the northern counties, there's the United Way, the Northeast Florida Community Action Agency, the Early Learning Coalition, and the Florida Diagnostic and Learning System. Nationally, to get information on mental health resources, please visit the National Alliance on Mental Illness, the Centers for Disease Control, and the National Institute of Mental Health websites for some more information. And if you are feeling like you are in danger of harming yourself, please call the Suicide Prevention Line at 1-800-273-8255 for assistance as well, or call your local mobile response team or 911. And remember, during our next session, we will be having Q&A with the clinicians. So we will have clinicians here to answer your questions. If you have a question that you would like to submit ahead of time, please email Denise Thomas at the email here, and we will be happy to answer those questions for you. Again, thank you so much for joining me for today's webinar. Please reach out for any assistance needed, and we would be happy to serve you. Hope everybody has a wonderful evening.